have another question from Ellen Cachero.
Mm-hmm.
And Ellen's question is, in my recovery, my hamstrings are an issue. Why would I have issues with my hamstrings now? I've never had issues before.
Again, Ellen, great question. I think you asked another question earlier on. I think you were one of the people who asked about the IT, or the iliotibial band, after surgery, and the answer to your question is similar to the answer to your previous question, and it's really the way you think about arthritis in the knee. Again, I think about it like a volume loss. So people lose cartilage, that joint shrinks down or becomes much more narrow. When that happens, your body reacts by trying to stabilize the joint. The only way that it knows how to do that is it tightens up the ligaments and the tendons and the muscles. So your hamstrings insert on your lower leg or your shin bone as a tendon, and they all tighten up with the arthritis. Okay. Once we replace the joint, we expand that space back to or close to where you were before you had arthritis, or near when you had very early arthritis. It tightens those muscles, tendons, and ligaments up, and it can take months and months and months. And that's often that persistent ache or sensation of stiffness, not necessarily loss of range of motion, but sensation of stiffness after surgery, which can persist, again, for a year to 18 months after surgery. But good, aggressive physical therapy. I always tell patients, long, slow, gradual stretching gets you a whole lot further than shorter, more repetitive stretches. But those are the reasons, Ellen, that you often have sort of persistent issues with tendons and muscles after joint replacement surgery.